Hi, good afternoon, everybody. I just thought I'd pop on and do a YouTube here, just kind of about my experience as a frontlines worker during a pandemic, which is something I've never done in my nursing career, to be honest with you. Now, I'm not frontlines in the aspect of working in like the ICU or being at a testing site. So a little bit about my background as a nurse. I've been a nurse 8 years now. I started out as a nurse's assistant or a nurse tech at Presbyterian back in 2008. And so I have been with Presbyterian for 12 years now, as I've worked as a tech, and then I went to nursing school, got my nursing license, and I've been a nurse for the past 8 years this year. So my background is step down ICU, meaning that the patients aren't ICU critical, but they're critical enough to where they need to be monitored on a heart monitor and just watched very closely because of medications we're giving them. They need to be on a heart monitor, and we have to be very vigilant with how we monitor and assess them. So after I got my nursing license, I was a nurse on a cardiac step-down ICU unit for about 4 years. I learned a lot of great things there, made a lot of awesome friends throughout my whole career, really. And then I currently work in Presbyterian Heart Group, which is an outpatient cardiology clinic. And I have been there the last 4 years. And I know a lot of you will know this if you know me, but there's people that may not. So I wanted to kind of give my background. So basically, as far as how this pandemic has changed my workflow, it was a challenge. So I went on a trip with a group from my church at the beginning of March and got back in the middle of March was when all this started going down. For us in Albuquerque, at least. So, the Albuquerque that I left on the 4th was completely different than the Albuquerque I came back to with this pandemic going on. So it was challenging to just wrap my mind around readjusting back to America after being in another country for a couple weeks. Which is always challenging, but when you come back in the midst of a pandemic, it's even more so. So basically, for the first 14 days that I was back, I was quarantined. I was at work, but I was quarantined in my own room just to make sure I didn't have any symptoms of coronavirus or COVID-19. And to just protect other people in the office if I was carrying. So they had me quarantined for 14 days. So that was kind of an adjustment too, as I was processing things from the trip and kind of just feeling lonely during that time. Just because it was just weird, like to come back from being around people to total isolation almost. So that was quite the first kind of work-related change that I experienced. And then I have my email set up on my phone, so I was getting constant updates about changes already through my phone. But I couldn't really have ever been prepared for the magnitude of how it would affect us in my job. So as far as my clinic job goes, it changed our workflow drastically because we then had to screen every single patient in the beginning to see if they were having symptoms of a fever, cough, any of the COVID symptoms. We had to screen these patients, and then, so the providers were still seeing patients, our doctors and mid-levels were still seeing patients for a few days after it kind of all started going down. And then they slowly went to telephone visits. So that meant that any patient that was at risk, like over 65 or had like respiratory history with respiratory issues or major cardiac issues, the doctors or our providers would make the decision to have those patients be seen through, or not seen, but called for a telephone appointment. So it required a lot of screening on the nurse's part to help screen these patients before their appointment to make sure that we did the right thing for them, which a lot of that was going on before I got back. So a lot of my coworkers were already doing that. So shout out to them because I know it was a crazy time. And so basically, our clinic is pretty empty other than emergent patients that we need to see to prevent them from going into the hospital. So we're still the doctors are doing telephone visits or video visits now with the patients mainly. But my job as a nurse there, I do telephone triage. So we still get calls from the patients every day. That doesn't change. And then we then have to make even more difficult decisions because phone triage is an art. I always tell people it's a skill you learn, just like hospital nursing. You learn sets of skills that you didn't have before. Because basically you have to assess people over the phone, which is really hard because they're not in front of you. And sometimes it's hard to know what decision to make for the patient. But we still get patients calling, with symptoms, and we have to decide, okay, should we have them risk coming in because they need to be seen so they can prevent a hospitalization, or can we do a telephone visit or a video visit for them? So that's just been a whole other level of critical thinking that we've had to acquire, and just trying to do the best that we can for our patients. So that's been really challenging. And then everybody's just really been stressed out with trying to maintain the safety precautions. Like one of the highlights of my coworkers and I, the highlights of our day are being able to have lunch together and just visit and kind of unwind from whatever's been going on with work. And I'm sure it's been the same in the hospital, but now we can't all eat together because we can't have more than 5 people in a room. So it's kind of been just a downer in that way, and the work environment feels very heavy, like just very, we all have great attitudes. I work with the best team out there, in my opinion, as far as coworkers. We all are doing great, but it's really been hard that you can feel the heaviness in the atmosphere when you walk into the hospital. And I can only imagine what my colleagues out in the hospital feel, especially the nurses working in the ICU. I just want to tell you guys, you're amazing. I admire you. Some of the best people I know work in the ICU, you guys. So if you know anybody that works in the ICU, or even if you're just a person who will send well wishes and prayers, please keep them in your prayers, because they're really, really, truly on the front lines of this, and they are being put at risk to do the best they can for these patients who are very sick, and it's a very unstable disease or virus, because we don't know a lot about it, and these patients, from what I hear, they crash very quickly. So shout out to ICU nurses really across America and across the world. My hat's off to you, and keep fighting the good fight. But so anyway, that's kind of what the clinic environment's been like. I know a lot of our providers, like doctors and nurse practitioners, physician's assistants, they're really discouraged about having to do phone visits because it's just really hard. As a provider, you want to be able to see your patient. You want to be able to look at them, listen to them, get a good assessment on them. And when you're on the phone, you can get an idea, but it's not the same as in person. So my hat's off to all our doctors and mid-level providers, as well as they provide care in a different way than what they've ever been used to. So I just really admire you guys too, as well as our MAs, our schedulers, our check-in, check-out desk people. You guys are awesome, and you are also taking a risk because, let's face it, people walk into the clinic, you don't know if they're a carrier or if they have the virus, and maybe they had symptoms that they didn't disclose when we called them to check, and then all of a sudden they show up and they're coughing, or they, we are screening people before they come into the hospital the best that we can, but still, there's a lot of unknowns. So anyway, hats off to you guys too. We just have a really phenomenal team, with Presbyterian across the board, and also our other hospitals, UNM and Lovelace. Hats off to you guys too. It's hard for everybody, so I really appreciate everybody in healthcare, and because I know a lot of people are they're doing things they haven't been used to. They're trying to learn new protocols they haven't. It's challenging. So anyway, I wanted to share this to just shed light on what it's like to be in healthcare at this time, at least from my perspective. Everybody has a different perspective. So, if you're in healthcare and you listen to this and you have something to add or a different perspective, please share it. I mean, I think it's good for the public to know what we're dealing with. Because education is the key to understanding, hopefully. So anyway, another thing I wanted to talk about is also a new thing that press is doing just to prepare us if we do have a big surge of COVID patients. Is they're having those of us in outpatient, some of us are retraining in the hospital because they're going to need everybody they can get if it does get to a critical point. Fortunately, in New Mexico, it's been a lot better than other places. But we do still have COVID patients. We have a couple units that are rule-out units or positive COVID patient units. And we do have patients in the ICU that are dealing with this illness. So it's still there. But thankfully, we have been able to keep our numbers down a lot lower than some other states because we have been more compliant with social distancing, hand hygiene, wearing a mask when you're out in the public. So all those things have been really good, I think. But so anyway, I just wanted to touch on my retraining in the hospital process and just really thank everybody for their prayers and encouragement, because it's pretty daunting when you've been out of that practice for a few years to wrap your mind around going back into it. But so basically my experience is progressive care or step down ICU before I came out to the outpatient clinic. So basically what that means is that they would retrain me on a floor like that to basically, in the event of a COVID surge, my understanding is that I would be used to take care of patients that are non-COVID so that nurses normally working with those patients could help with COVID patients. So basically the last couple days before today, I trained on a step down progressive care unit. The patients had telemetry and various things going on, which I can't really go into patient details because that violates our HIPAA guidelines, so I won't really go into that too much. But I will just tell you that it was amazing to see that I could still do those skills, that they would come to mind, and that basically the biggest challenge for me, I found, is just getting my flow down again, because when you're managing 4 acutely ill patients in the hospital, anything can happen at any moment. And so you really have to be on your game. And so, I mean, they didn't give me 4 patients to start. They've been working us up to the 4. So yesterday I took 2 patients, and they were both pretty sick, had issues with cancer and GI bleed issues requiring a lot of monitoring, a lot of output from different drains they had placed for different procedures, things I hadn't worked with in a good 4 years. And so it was like, of course, I had support from experienced nurses that are currently working there, so that was awesome. But I came home from both shifts just totally exhausted, because your mind's going 90 miles a minute trying to figure out, okay, what should I do first? You got to get down your prioritizing of caring for these patients, and just make sure you're on time with their meds. You're following if they're having pain. One of the patients had issues with nausea from surgeries that were done. So trying to kind of manage that and keep on top of things so that they can have the best outcome possible before leaving the hospital, as well as being careful with, my hand hygiene. We now have to wear a mask. If you're in the press facility at all, you have to wear a surgical mask. And then, of course, if you're working with the COVID patients, you have to have an N95 respirator. So one thing that did come up during my shift yesterday was that a patient was needing to be tested for COVID, and we didn't know till later in the day. And so this person had not had any symptoms, but, they were a rule out, and they had one negative test already. and then they needed a repeat test. So basically I had to test this person, which means the swab is going in their nose as far back as you can get it, which the patient hates, of course, who wouldn't? And then I had to wear a respirator and, just get that testing done. And I wouldn't say that I'm afraid to take care of patients anywhere, but going into the unknown, not knowing if you're going to get exposed or be a carrier to bring it to someone you love or care about, that does make me nervous. So, a blessing for me is that I do live alone, so I wouldn't have to worry about it coming back home with me. But just day-to-day interactions with people, I'm maintaining social distancing and doing what I can to be safe, but it's still a concern, I think, for nurses everywhere. Just the fear of carrying this thing to somebody they love or getting it themselves. We're human. And this illness, there's, of course there's people that are medically fragile that are higher risk, but this thing is affecting people that are perfectly healthy too. So it's something that we should take seriously. And with my belief in God, I don't live in fear because I know that He's got this and He's in control and He's going to get us through it. But that doesn't mean that I'm not going to be wise and take precautions that I need to. Especially being in healthcare, we just see the worst of the worst. So I would just encourage everybody to try and follow the guidelines that are put out. And to know that it really is for your own good and your own safety and the safety of those you love. Because this COVID is so unknown still. We don't have a vaccine for it. We don't have a lot of answers with it. And so the best way to protect ourselves is to follow these precautions. I know that it's hard for a number of reasons. But I can tell you, I've not seen or worked directly with any COVID patients at this point, but the stories I've heard are devastating about, just the struggles healthcare workers are having caring for these patients and just the toll it's taken on them. So, I would just say try to be patient with each other and show grace where you can, and just remember all the front lines workers, even apart from healthcare, the people in the grocery stores, the people at the post office, the people everywhere that need to keep our society running. So there's considered essential workers. Just remember them and keep them in your prayers because, it's a trying time and everybody's doing their best to get through. So I would just say that, and I would just say, after working 2 12-hour shifts, I'm worn out. And also, I know a lot of healthcare workers, you guys have probably already heard, they've shared pictures of the mask, damaging their face because they have to wear it so long, the N95 respirators. And even on the surgical mask, something I noticed was the back of my ears started to get tender with those straps. They are making gear headbands and stuff so we can keep them off of our ears. But even having to wear a mask for 12, 13, 14 hours, that's hard. And we do it because we have to. We have to keep ourselves safe, and we have to keep the people we're caring for safe, and our coworkers. But it's no easy thing. It's you can't breathe very well with that on. So just that's an exhausting thing too. And I've only done 2 shifts, but I can only imagine my colleagues who do this 3 or 4 days a week, especially in the ICUs. Like I said, they're really in the trenches of it. So anyway, if you have questions about anything in nursing or healthcare, I'll do my best to answer, or drop me a comment on this video. I just kind of thought my friend Heather had told me, that would be really cool if you shared this on your YouTube channel, just to, give people some insight into what it's like to be a frontlines worker. So anyway, I hope it's helpful, and I hope it's an encouragement. Just let you guys know what our experience has been So God bless and stay safe. Remember that God is in control, but you should still wash your hands and take the precautions. Have a great day.